Wellness Wednesday, sponsored by Baptist Health.
Welcome back. It's summer in Arkansas, and though we are more aware of ticks this time of year, they are actually here all 12 months. However, we are hearing that Arkansas is experiencing more tick bites, which is why we wanted to check in with Baptist Health's Dr. Sarah Beth Holcomb. Dr. Holcomb, thank you so much for being here.
Thank you for having me.
So, we were just talking about how we really need to pay attention to ticks on our dogs, but as a doctor, are you seeing or hearing more about tick bites in your clinic?
Yes, sir. So we always see a fair amount of tick-borne illnesses, especially in the early spring, summer, and fall months. But as you said, we see them all year round. You know, ticks are vectors for bacteria, parasites, viruses. They also cause immune responses, like individuals that have alpha-gal. That's actually an immune response from a tick bite from a molecule in its saliva. It causes an allergy to red meat.
I think I want to say yuck.
Same.
So Arkansas has a number of ticks. Are some more likely to carry diseases than others?
So we have so many ticks. You can see from these pictures, they're really hard to identify. Some are smaller than poppy seeds, but some of the more notorious one would be the Lone Star tick, the American dog tick, and the deer tick. The Lone Star tick is distinctive. It's very populated here, and it has a dot on its back, so you can kind of tell what that one is. It carries human ehrlichiosis, tularemia, and stari. That's southern tick-associated rash illness. Your dog ticks are the vectors for Rocky Mountain spotted fever and tularemia. And then your deer ticks they carry babesiosis and anaplasmosis.
I don't want any of that.
No one does.
So what are some of the symptoms that you want people to be aware of if they've had a tick bite?
Okay, so fever and chills are very common. Headaches, muscle aches and pains can be significant. Some have associated joint pains. Often tick-borne illnesses have very distinctive rashes that help us determine what illness we're dealing with.
And what are the treatment options available, and how important is it that people seek treatment?
So, you know, these illnesses can range from mild illnesses that you can treat at home easily to, you know, illnesses requiring hospitalizations. They're easily treated with antibiotics, but you want to seek, you know, care with your doc, especially if you know you've been bitten and you've pulled off a tick.
Well, let's talk about prevention. What is out there and what should we be doing?
Of course, there are repellents. Definitely protective clothing. I ask people to most certainly wear light-colored clothes, tuck your shirt into your pants into your socks. It doesn't matter if you look cool, if you're going to be in the woods. Stay on the path. Avoid their habitats like tall, ungroomed grasses and you know, lots of down limbs and trees. That's where they're hanging out. And of course, tick checks. You want to make sure that you're checking yourself and your pets. You want to check within a couple of hours of being out, and it can be helpful to shower to wash off any unattached ticks.
Well, thank you so much, Dr. Holcomb.
Absolutely.
If you would like to get in contact with Baptist, just head over to their website or give them a call. That information right now is on the screen.